This portion of the presentation helps you understand what to expect in practical nursing clinical classes. Welcome to the clinical portion of your nursing education. Students who have a plan to manage responsibilities and sequester serious study time have made good preparation for success. You are learning the necessary skills for one of the most highly regarded careers in the world. Nursing is embodied in Dr. King's quote, "Every day presents an opportunity to make a difference in someone's life." Ms. Vernon wants practical nursing students to know that the instructors are there to support their students, but students are held to a high standard of excellence. In this segment of the presentation, we will discuss what it means to be a nurse, the varying times of day classes are offered, the nursing process, program objectives, Nursing 115, the great risk of overcommitting, what a nursing student can expect for time commitments, clinical preparation, and clinical locations, and what nursing instructors expect of students. To be a nurse is a calling that's difficult to describe in words. Who can say why a person would want to do a nurse's work? But those who do will tell you there is nothing as fulfilling or rewarding. Nurses stay by the side of those they serve through the worst times and celebrate with patients and families in the best times. There's an intimacy nurses and patients share which is understood. The essence of nursing is an unconditional love for mankind. To be called a nurse is an honor, a profession of the highest realm. You will begin to learn the truth to this quote as soon as you have your first lecture and your first patient assignment. Learning and successfully completing nursing will be unlike anything you've done before. It requires a special set of skills in many areas, including critical thinking. When students take this 2-credit-hour class in the week before clinical classes begin, evidence shows they are more successful. It really works. When a student begins nursing clinical courses in January or spring semester, they will be attending classes in Seneca at the Oconee campus and going to classes later in the day. But surgery, children's clinics, and OB clinics are available only during the morning. So students must expect to have flexibility. When you start in January and are successful each semester, you can expect to graduate in December of the same year and apply for the NCLEX PN exam. The clinical courses are sequential and cannot be compressed into any shorter period of time. Students who begin classes in August will have a morning or early afternoon schedule. Many clinical sites are available to students only during the day, so your scheduled clinical hours should cover time-sensitive areas like surgery, children's clinics, and OB clinics. When you start in August and are successful in each semester, you can expect to graduate in August of the following year. Beginning in August of 2011, our fall program will be offered at our Easley campus. The clinical portion of the program will be at ANMED in Anderson and at area nursing homes. A student will hear this term mentioned in every nursing course until graduation. It involves critical thinking, assessment, nursing diagnosis, planning, implementation, and evaluation of nursing care. Each sequential course builds on the knowledge, skills, and critical thinking a nursing student is gaining, becoming more complex and involved with each semester. Program objectives. Students will learn how to implement the nursing process in caring for their patients. We expect you to conduct yourself as professionals, arriving on time, being prepared, making a sincere effort, and taking responsibility for your actions and your own learning. You will work to improve communication skills, both conversational and therapeutic. An emphasis is placed on safe nursing practice, and you're prepared to take the NCLEX PN throughout the program. Memorizing is what you've done all your life to pass tests. An example might be, what is your blood pressure? Understanding is knowing how the facts you learned work together. An example would be, what does 120 over 80 mean, and is it okay? Application is using that understanding to solve a problem. Should I give the blood pressure medication? How and when? Nursing school is very demanding. Students have a hard time believing this slide until they actually enter clinical courses. Then sometimes it's too late. A student who doesn't have enough time to really study will spend the rest of the semester playing catch-up for a failing grade. It takes at least 3 hours of study for each credit hour of class. The students we see at most risk of failing a class are the ones who add too much to their nursing school schedule. Sometimes students try to retain a full-time job. Some try to combine nursing with other courses. We include this information for your benefit. If you know ahead of time that you're putting yourself at risk, then you can plan for management of your time and family responsibilities. Other ways your time is used could be online modules may need to be completed with pre and post testing to learn skills. Study habits may need to be altered to fit new content. The reading is more difficult with unfamiliar terms and content. Some relearning of areas like math may be needed for medication and math calculations. Opportunities for unique learning may be made available outside of normal class or lab hours. These represent clinical skills taught in PNR 110. These skills will be taught in the lab or classroom prior to going to the clinical site. Students have found it helpful to review skills checkoffs in the text and video presentations on the nursing lab computers. In PNR 110, the clinical skills are taught in an on-campus lab. The student can expect to learn patient nutrition, therapeutic communication, and confidentiality. PNR 120 is the first class that uses an off-campus clinical site like the hospital or an area nursing home. The nursing process is the framework for effective patient care. A PNR student will begin to learn and practice this process, which involves assessment, diagnosis, interventions, and evaluation. Students usually call this the toughest semester. PNR students will take an online pharmacology course. This is a time-consuming course with a weekly homework component. Pharmacology is a complex concept due to the various ways patients react to medications, numbers of different medications a patient may be taking, and calculating dosages. In PNR 130 and PNR 140, a student will review body systems and diseases that affect those systems. They will increase nursing process skills. They will demonstrate their understanding by creating care maps and care plans for the patients they are assigned in clinical lab. Nursing care of family focuses on nursing care of the family during the childbearing and child-rearing years. Clinical sites may include both acute and community settings. In the simulation lab, there's a patient simulator that gives birth. This allows the lab coordinator to demonstrate and explain the process and risks of childbirth. NCLEX PN is your licensing exam. Great care is taken to prepare you for and help you apply for and take the licensing exam. You are entering one of the most respected and trusted professions. We expect you to conduct yourself as a professional, arriving on time, being prepared, making a sincere effort, and taking responsibility for your actions and your own learning. That means arriving on time even if you had trouble sleeping the night before, being prepared by pre-reading content before class, and making a sincere effort by participating in class to understand and clarify. A student who is self-disciplined stays on task as needed and manages time to focus on priorities. A student who is sensitive to diversity expresses appreciation of human differences. A student who is reflective and self-corrective carefully considers meaning of data and interpersonal interactions, asks for feedback, corrects own thinking, and is alert to potential errors by self and others, and finds ways to avoid future mistakes. A student who is courageous, stands up for beliefs, advocates for others, and doesn't hide from challenges. A student who is flexible, changes approaches as needed to get the best results. A student who is empathetic, listens well, and shows ability to imagine others' feelings and difficulties. In summary, student preparation helps make the sacrifices easier to manage for students and their families, and the rewards are great.